Tonight's Taking Questions is with Dr. Laura Meihofer, who is a physical therapist who specializes in the treatment of the pelvic floor. She's worked in this field for nearly 10 years, obtaining her training at the Mayo Clinic, and has recently established her own private practice, as well as social media platforms where women can go to get educated. Welcome, Dr. Meihofer.
Thank you.
Thank you for joining us.
Yes.
My first question, what exactly is the pelvic floor?
Well, I'm so glad you asked because it is often an area that is completely forgotten about. So the pelvic floor is this glorious group of 26 muscles. No matter what genitalia you were born with, everyone has them. They attach behind the front of our pubic bone, which is that bone that's in the bottom part of your abdomen. And then they run like a sling or a hammock and they attach into the tailbone and sacrum. So they close out the entire bottom part of our pelvis. So a lot of times when people think about these muscles, they most commonly think about childbirth and the effect that childbirth had, but they have a lot of other things that they deal with.
What are the most common causes that start pelvic pain? And what are the conditions that can benefit from pelvic floor therapy?
Yes. So I think if I explain first what the major functions of the pelvic floor are, that will inform our next answer. So the pelvic floor helps to give stability to our back and our hips. It also deals with our bladder and bowel continence. It deals with sexual appreciation, which is one of everyone's favorite functions. It helps to support all of our pelvic organs, and it also deals with circulation for our lymph. So because the pelvic floor has to be able to contract and relax, it oftentimes can kind of get confused. So when you ask about pelvic pain in particular, most commonly what I see is that individuals' pelvic floor muscles are very tight and held, kind of like if you were to squeeze your hand really tight, you can see all of the blood flow that's not going to your knuckles. That is what can cause that pelvic pain. And so to lead into your other question about why someone would seek out a physical therapist like me, well, that really comes down to if you have dysfunctions in any one of those domains or categories that I explained. So oftentimes on my different social media platforms, people will reach out and say, Laura, I'm having pain with intercourse. I'm peeing my pants when I jump or hike. I have back pain that doesn't seem to go away. Those are the things where you say, I need to come into a physical therapist because we need to work on making those muscles more functional and better at doing their job.
I think you just talked about it, the bladder issues and incontinence. And that is a big thing for women, for somebody like me, especially. I saw on one of your posts, and I thought this was great. It said you should be getting somewhere between 6 to 8 hours of sleep at night, uninterrupted. How does that happen?
Yes.
Can you give us some tips on that?
Yes. Well, when we think about sleep and things that can disrupt our sleep, one of the things is going to the bathroom at night. So we call that nocturia, which is just getting up to pee at night. And so
nocturia?
Yes, nocturia.
Is that trademarked?
No, I don't believe so.
You trademark that.
Yes, I think it's always great that people understand what these medical terms are, because then it allows them to speak more clearly to their medical team. And it also allows them to search for information a lot more thoughtfully. So when we think of things that can interrupt our sleep, one of the big ones is nighttime voiding. So, with that being said, there are different behavioral modifications you can do to minimize that so you can maximize your hours of sleep. One of those things is stopping fluids 2 hours before bedtime. Another is seeing, are you consuming what is known as a dietary bladder irritant? So frequently, before people go to bed, they might have a glass of wine. Well, alcohol can be a dietary bladder irritant. And then when we start resting and moving into sleep, it can cause our bladder to contract and wake us up. So there are different things that individuals can do that are not hormonal changes, are not taking medicine or surgery to fix some of these problems.
You talked about diet and how a little bit about dietary, the irritants. Does diet, so diet, it does play a huge role in this. And then my next question is, are there common foods besides wine or drinks that are common irritants?
Yes. So common irritants can range from apples, melons, lemons, limes. It can also be medications that have caffeine in them, chocolate, tomatoes, onions, spicy foods. So there's a large range of things that can affect the bladder. Everyone kind of freaks out because they'll say, "Well, Laura, I eat a lot of those. I drink a lot of those."
You literally just gave everything I eat. So yeah.
Yes. So you can again inform yourself by trying to avoid those things for 3 days and then add them back in varying quantities to see, when I consume my tomatoes, does that make me wake up at night? Does that make me have the urge to urinate? If it does, then we know that's an irritant, and you can choose to keep it in your life, or you can choose to get rid of it and see how that affects your sleep.
Right. So what you're saying is the 8 cups of coffee that I have a day might be a reason why I'm getting up to go to the bathroom 3 times a night?
Yes, yes.
Okay.
So a lot of times I think people tie in their inability to fall asleep because they or stay asleep to stress or other things that can be attributed to aging,
Mhm.
menopause, all of those things. But a lot of times we can think about these other avenues that can still serve people to give them that better quality of life.
Right. Are there some foods that are a non-irritant? So foods
There-
that are good that you can
yeah.
take and not worry about it?
Yes. So, and interestingly, clearly I must be a lover of wine, but I have found that red wine, and specifically red wine that's organic or sulfate free, can be easier on the bladder. Watermelon can be easier on the bladder. Cucumbers, basil, blackberries, blueberries. So there's a lot of things that also you can still enjoy. And I believe on my Instagram account, Laura Meihofer, in the link in bio, there is a dietary bladder irritant list. And I offer both the things that irritate as well as the things that you can start to implement in. So if anyone is interested in that, just hop on over there and get it.
But what you're saying is I can still drink white wine. I just have to take it in moderation, and then see if I adjust my white wine intake, does it make me go to the bathroom less at night?
Yes, correct.
And if it's not affecting me, then what you're saying is I can go ahead and drink all the white wine I want.
Exactly. So I am a true believer that I never want to necessarily tell people, don't do this,
Right.
only do this. I think that every person should take this information in and try it on for size. Really give it a chance to see, how does this feel in my body and how does this sit in my body? Because I have had many clients who might find that white wine is irritating, but if they take a sip of water and then they go to take a sip of wine and they kind of alternate, it can dilute it enough to not affect them. So again, we have to do these little experiments to see what works for us.
Right. And I think, you hit the nail on the head because it is such an individual journey. What works for me may not necessarily work for somebody else. And at Women-ness, we are always encouraging women to talk to their doctors, right? We are not the experts at Women-ness. We have wonderful solutions to make your life easier and help with relief on the symptoms, but by no means are we telling you what you should do. It is a very, very individual journey and tailored to each person. Speaking of our community, we did ask our community to send in some questions, and nothing was off limits. So I do have, right? We love that.
Yeah.
I have a great one to kick it off with. Kegels. Someone wants to know the real scoop. How many, how often, and frankly, are we just wasting our time?
Correct. So I love this question. I get it quite often. So Kegels basically is just another word for pelvic floor strengthening. And I would say when I see people who think they're Kegling or tightening their pelvic floor correctly, they're most oftentimes doing it incorrectly. So to everyone listening right now, and Anne, you can even practice this.
I'm going to right now.
Everyone sitting nice and even through their seats. I want you to think about tightening your pelvic floor as if you're trying to stop the flow of urine, and then release that. So what you should feel when that happens is a lifting of your pelvic floor. I'm going to try a different cue to see if you can feel it differently. I want you to tighten as if you're trying not to pass gas, and then relax. Okay. So we're working the same muscles, but we're just giving you a different cue to do them. So there are actually, so when people ask, are they wasting their time? If you are just doing a tighten and a hold, and a relax, you are actually only working half of the muscles. So you are kind of wasting your time. The other type of strengthening or tightening you should do is known as quick contractions. So that's where you tighten, relax, tighten, relax, tighten, relax. So everyone, we'll try it right now. I want you to go ahead and tighten like you're stopping the flow of urine. Now let it go. Tighten, let it go. Tighten, let it go. Tighten, let it go. Good. So this is a contraction that we experience usually with orgasm and when we cough, sneeze, or laugh. So to truly train those pelvic floor muscles, you should be doing both types of contractions. Roughly, we're shooting for around 30 repetitions of each because that's what research shows really helps us gain and then maintain those strength benefits. And then I have one little plug for a Woman-ness product.
Ooh,
that is for Gold Vibes. What I love about this product is you can place it inside the vaginal canal and then you can work on squeezing around it and it gives you some feedback. So if when I just explained to you those two different cues and you had difficulty feeling that lift, you could always use something like this Gold Vibes as feedback in the vaginal canal to sense if you're doing it correctly. And then when you turn on the vibrator, it will help to facilitate muscle contraction. So that's one of the things I really enjoy about Woman-ness is that these are easy to obtain because they're in our local Target stores and they're affordable. So people can do their own at-home physical therapy with something that they can get while they're picking up their groceries.
Well, thank you for that plug. We came up with, Sally and Michelle, our founders, came up with these wonderful products that are to help make women's lives easier, like I said, through this transition. And the Gold Vibes, the vibrator that you just showed, is one of our best-selling products, and that is wonderful. Another question from our community: info on perimenopause and urinary incompetence and vaginal dryness. So we haven't talked about vaginal dryness yet, and certainly that's something that women come up against all the time.
So let's first start with vaginal dryness. I think that it's really important to note that Perimenopause, menopause, and postmenopause, that perimenopause period can come on very slowly. So it could be something that someone has been experiencing really for 10 years. Many times people think it's just this switch that is flipped. And so what I'm finding as a pelvic floor physical therapist is that we really have to educate people to start using vaginal moisturizer in their 30s and not wait until we're in that menopausal time. So the nice thing about the Daily V Soothe, which is a Womanness product, is that you can use it not only for vaginal moisture, but you can also use it for lubrication. Now, I have my vulva puppet.
I love this. I'm so glad you brought this.
Yes, and so I love this puppet because it's a great way to teach people how to apply lubricant. So we have our clitoris here, which is underneath the clitoral hood. The flower here is the urethra, and then we have the vaginal opening, okay? But when we separate our labia, this area within the labia minora is known as the vestibule. So when you are putting on vaginal moisturizer or even lubricant for sexual activity, you want to make sure that you're getting it within that vestibule as you place it on, and then also slightly into the vagina. So I always tell people, if you look at your knuckles, my first knuckle, I should place that kind of within the vagina and then on the ridge of the vagina, and then the rest within that labia minora. And that's what's going to allow you to really get the benefits of the moisture that you're applying there.
That was really helpful. Thank you. I'm so glad you brought the puppet. I meant to tell you that before the interview.
Yes.
I have this great question here. Any tips on better sex for both myself and my partner, and how to prevent, these are two questions, and how to prevent leakage during high intensity workouts? And yes. I guess I would say, isn't sex supposed to be a high intensity workout?
Yes, so I definitely think that sex should be looked at more as an athletic event. So I definitely agree with you on that. First, let's go ahead and talk about the how to increase our orgasmic capacity or our sexual appreciation. So one of the things that I think is important for everyone to do is to focus on their sensations. Oftentimes I find with my female clients, we're running a list of things to do in our head, and that can inhibit us from being in the moment. So when you are trying to do that sexy time, whether it's alone or with a partner, just kind of take a screenshot of what might be going on in your mind. Are you focusing on the smell, the touch, the sight, okay, how things feel? Or are you thinking about, okay, before I go to bed, I have to remember to put the laundry away.
I gotta feed the dog.
Yep, exactly. So what are you thinking about? And when we start to understand that, we can start to understand how to intervene. So for some people, they'll put a pad of paper next to their bed to write down kind of their worries. I had one person who needed to install a door lock on their door because they were worried that their kids would come in. So whatever the barrier is, start to kind of be aware of that. Are you really tired? So a lot of times people say you typically go to bed at 10, and then that's when, you start making the moves. Well, that's you're sleepy, so start earlier. Now, when we're thinking about how to increase our orgasmic capacity, it can be really helpful to use a vibrator. So when you're working with the vibrator, everyone thinks the clitoris is just underneath this hood here. And so oftentimes they're placing the vibrator, which this is actually nice with this vibe. It has this flat piece where you can put it through here. But actually the clitoris has legs that go down the sides of our vaginal canal. So you might find that one side versus the other is more sensitive to touch. You might find moving the vibrator down the side of the labia gets more excitation, or even placing it on the pubic bone. So those are simple tips for how to make things better. to go to your other question, which was about urinary incontinence with activity, what I think is important for people to do is focus on what are you doing with your breathing. Oftentimes when I'm jumping, when I'm running, when I'm squatting, I will breath hold. And when we breath hold, that increases the pressure in our abdomen and causes leaking through the urethra. But if I exhale as I jump, if I exhale as I lift something heavy, that's going to control the pressure and better allow our pelvic floor muscles to tighten and close that urethra.
I actually never knew that, and I suffer from leakage pretty severely, and I didn't know that. So I'm constantly doing this. I'm constantly doing that anyway. But I don't not even have to be jumping to be so like that. The next question that I had is, on the site, you had talked about the taboo subjects. There are so many taboo subjects, whether it's, we talk about sexual health, we talk about menopause. You have a list of things that we shouldn't be apologizing for.
Exactly. So I think for so many years, women have been pushed to the background. And in actuality, women haven't been included in a lot of the medical research, and they're just now being allowed in research. Excuse me, my dog's giving a little bit of and so I think with that, for so long, women have been sort of the decision maker of their families, that it's time to stop apologizing that we change when we age. Stop apologizing for having thoughts, feelings, and wanting to advocate for your rights. Start kind of sitting in your power and glory and beauty and say, I deserve better. And take that mentality and bring that to your shopping list when you're going through and looking for products that serve you. Take that mentality when you go to your doctor to advocate for yourself, because women are literally half of the population, yet we oftentimes get just such a small piece of the marketing and products that truly help us. So I think that no matter where you are on the age spectrum, you should really feel proud that you're there and know that there are people and companies that can support you through that. And don't feel bad about it, because you're not alone.
No, you're not alone. And we hear from women every single day, especially through our website. And we have this wonderful, the bot, where they're communicating directly with us. It's us. When you go on to womenist.com and you have a question, you want to know, what should I be taking for the night sweats? What should I be doing if I'm jumping and I'm not breathing correctly? What kind of, go-go liners do you have? But they want to talk. They want to feel that sense of community. They want to know that there's a live person out there, that they're not crazy, that these are things that they are going through. And frankly, every woman has to go through it, whether you've had kids, whether you haven't. We all have to go through it. And so it is wonderful to have this conversation, and certainly have people like you that we can go to and talk to frankly, with a great sense of humor. I do love what you do on your social media. You literally had me dancing today. So for those of you watching, she did a post about lubricants, and she had this music on and showing the different, lubricants. And there, I said to you, I'm like, I'm literally dancing. But it's great, and the energy is great, and having that place to ask questions is wonderful.
And I think, that's really, to all the individuals watching this, health and wellness can be fun. It doesn't need to be shameful. Like you said, people deal with leaking when they're exercising, when they're doing different things. And I personally like and enjoy kind of being a little bit tongue in cheek about it. I always say I wasn't necessarily raised in a sex positive family, but I was raised in a family that was very anatomy positive. So take time, lean on your resources to learn what the different pieces of your body are. Watch this back so you can see, what did she mean by vestibule? Because when you go into the doctor or nurse practitioner, PA, physical therapist, whoever it is, you're going to be able to really advocate for yourself, and you can do it in a way that's fun and not so doom and gloom.
Right. So what you're saying is, at the end of the day, you don't have to live with these symptoms. You have help and you have people to talk to. So what if you don't have access to a pelvic floor therapist locally? What can you do?
So there are a lot of great search engines out there. I actually have a YouTube channel, just Laura Meihofer, LLC, and I have a video that breaks down what each one of those search engines are so that you can find a good provider in your area. And then I also share 3 questions to ask. So have you treated this condition before? So if you're dealing with vaginal atrophy, which is thinning of those vaginal tissues as you go through menopause, ask, have you treated someone with this condition before? If they say no, then you know that's not the right provider for you. You can ask, how long have you been working in this area and what courses have you taken, to really decipher who's going to be a good provider and who's not. And then always on my site, I offer kind of like an over the phone. I have a free consultation for 20 minutes, but I also offer, for those that are far away, a phone consultation to get you started with exercises, a program, and help you decipher who's a good therapist and who's not. So again, never feel alone, because you're not. There are always people out here who care and want to help you.
That's great. Before we go, what are some of your favorite stretches for the pelvic floor?
This is a great question. So I love yoga stretches. I particularly love child's pose, is one of my favorite. I also like a happy baby pose, and I like to modify it by having someone place their legs up on their ottoman so they can be nicely supported and relaxed. And in these 2 postures, it really allows for the pelvic floor muscles to relax and have range of motion. And when we have range of motion, we can have stronger muscles, which means we can have better control with our continence. We can have stronger orgasms. We can have better support through our back. So those are probably my top 2. And I ask that people do those about 2 times a day, holding each one for 90 seconds. And if you're at all confused about how to get into those poses or modify them, I have videos on that on my YouTube channel, because everyone's body is different, and I want to make sure it is accessible to you.
That's great. And then the Kegels, how many times a day are we doing those? 30, you said 30? How many times a day?
Yep. So do 30 quick contractions in 10 repetition increments, and do 30 sustained holds, holding up to 10 seconds. And you just need to do that 1 time a day, because you're going through basically 3 sets 1 time a day, and then doing them that way. And that will really, really, really help. But if you still are struggling with it, make sure you reach out to a pelvic floor PT.
Wonderful. I'm doing it now. Can you tell?
Usually I can tell because people's eyebrows go up and down, or their shoulders go up and down. So I'm like, oh, I know you're Kegeling.
Oh. Well, thank you so much for joining me tonight on Taking Questions With. This is Dr. Laura Meihofer. And again, I'm Ann Gobel with Womeness and the After Party.
Yes,
Thanks again.
Thank you, Ann, and thank you, Womanness. This was amazing.